Welcome to today's video. Today we have a patient I've not seen before, and she's really a delight. What you'll see is that she is in a wheelchair and has some interesting attachments to the wheelchair that accommodate her deformities from cerebral palsy, or as we call it, CP. Many people with cerebral palsy do have some intellectual disability, but the vast majority do not. And what you'll see is that she is delightful and very sweet, and it helps remind us not to talk down to people just because they're in a wheelchair or look a little bit different from ourselves. So she's lovely, and I hope that you enjoy today's video. So this is the first time we've met together.
Yeah.
Okay. And this is kind of a cool looking wheelchair. Can you tell me a little bit about it?
Well, since my knees are straight, as you see, that has a place for me to keep my feet so I don't fall out of the chair.
Okay. Now, do your knees move at all?
A little bit, but not very much.
Okay. And all of the knee surgeries and stuff are because of
Cerebral palsy, yep.
Okay. And you are also, it looks like, born with a club foot. Is that correct?
No, that was because of my cerebral palsy.
Okay, so it changed actually the position of your foot, the shape of it, so that it's hard to walk. It would be very hard to walk on a foot like this, I think.
Yeah.
But how long has it been since you were walking?
A couple of years.
Oh, okay. So you walked well into your 20s and even your 30s.
The reason I stopped walking is because like I said, I got a grade 4 sprain or something, and
In your ankle?
yeah,
Okay.
and I stopped moving because it hurt.
Mm-hmm.
So then I just got really tense and everything
Okay.
stiffened up, so now I'm trying to make it so it's not stiff anymore.
So you're doing a lot of physical therapy?
Yep.
Okay. And is there a chance you're going to not have to be in the wheelchair so much?
Hopefully.
Okay, that's great. All right, let's, well, thank you for explaining all of that.
I got diagnosed when I was 6 months old.
With cerebral palsy?
Yeah.
And as we know, cerebral palsy really, it's a brain issue, but it affects your muscles and your skeleton, not your brain. Right.
It does a little bit, but it affects the movement part of the brain. I don't know what that's called, but
Yeah, well, we'll call it the movement part of the brain.
it makes it hard to walk. Sometimes it tightens up.
Yeah, you tell your body to move and it doesn't want to listen.
No. Sometimes not.
Well, let's go ahead and we'll put this, get rid of the little nail crumbs here that fell in. And we'll, now have you ever had a podiatrist trim your nails before?
Yes,
Okay.
but my people thought it'd be better for me to go to an actual podiatrist instead of having a podiatrist come to my house, because my toenails tend to grow really fast.
I'm not getting this to move. What am I doing?
You have
Push this back.
Yeah, you have to push it this.
There we go.
There you go.
Okay. Okay. Yeah, so with your diabetes, your insurance will allow you to come in every 2 months. So what we'll do is we'll get you back on the schedule for 2 months.
Okay.
And then they won't get this long again.
All right.
So I apologize to my assistant who is doing the filming right now that I'm just dropping all these nail pieces on the floor. But we always vacuum in between patients, so
That's good.
yeah. So is there anything else you'd like to let the people watching this video know about cerebral palsy or your wheelchair or anything like that?
No. You have to have a lot of surgeries due to cerebral palsy usually to be able to move.
Yeah.
Right now, I just recently got a Baclofen pump installed, which is
Oh, wonderful.
a machine that gives me muscle relaxers right into my legs.
Right, they put it in your spinal cord, right?
They put it in my stomach, and then the tubing for the medicine goes in my spinal cord.
Right,
I have a catheter.
Yeah, and what it does is it just allows, it calms the muscles down so they're not pulling you into such a tight position.
Basically, yes.
Okay. Yeah, that's a great option. But everything else here looks really good. I don't see anything in between the toes. You had said athlete's foot, but I don't see any evidence of it, so the medicine you're using is working.
Mm-hmm.
So let's just get a little bit of lotion on. And then did you have shoes and socks with you today?
No, I don't have any on because it's hard to put shoes and socks on when you're like this.
Okay. So let's just get you back. There you go. Get a little bit on the other foot. And thank you for letting us do the video. And I think that, people will learn, a little bit about CP and some of the stuff that goes with it. So I appreciate that. Any questions for me?
No.
All right. Well, thank you for letting us do the video.
Yep.